Now to that controversial story now, and the Ministry of Health has confirmed ongoing talks with the U.S. government to set up quarantine centers for American citizens exposed to or infected by the deadly Ebola disease that has ravaged the Democratic Republic of Congo and the neighbouring Uganda. In a news release wired to newsrooms, Health Cabinet Secretary Aden Duale said any arrangements regarding similar cooperation will be guided by Kenya's national laws, public health regulations, biosafety and biosecurity standards. And as concerns continue to swirl around the request by President Donald Trump's administration and the safety of Kenyans, infectious disease experts advise that provided the cases are confined in isolation centers and handled by qualified personnel, the move should not be a cause for alarm. Gloria Milimu reports.
The Ebola situation in the Democratic Republic of Congo and the neighbouring Uganda has now forced countries, including Kenya, to heighten their surveillance and screening for the rare Bundibujo species. So far, 7 cases have been confirmed in Uganda. But revelations that Kenya may host quarantine centers for American citizens suspected of contracting the Ebola virus is causing jitters among the populace. Many accusing the government of exposing Kenyans to the virus. In what is viewed as a shift in its response strategy to such epidemics, the U.S. government allegedly intends to deploy its health officers to attend to Americans in the quarantine centers should they get an approval from the Kenyan government. Despite eliciting concerns among Kenyans, infectious disease specialists say the move would not compromise the safety of Kenyans.
There's no risk of Ebola spilling into the Kenyan population as long as the patients are confined within the isolation center and the people handling them are very well trained.
They also say that the U.S. might have opted to set up a quarantine center in Kenya due to its highly advanced medical infrastructure, robust disease surveillance, and its high-tier health facilities that make it a medical hub for internationals during such epidemics.
So why Kenya has been selected, I think, is because of the infrastructure. I mean, health infrastructure in Kenya is, I think, more advanced than most of the countries that are neighboring, both Uganda and DRC.
Speaking about the controversial issue, the Ministry of Health says that any arrangements regarding international cooperation will be guided by Kenya's national laws, public health regulations, biosafety and biosecurity standards, and the overriding responsibility of government to safeguard the health and welfare of the people of Kenya. In what seems to be acknowledging talks to pave way for the U.S. government to set up quarantine centers for U.S. nationals in Kenya, the ministry says it notes ongoing discussions with the Trump administration and other global partners regarding international collaboration on strengthening preparedness and response mechanisms for Ebola and other emerging public health threats. Setting up a quarantine center, they say, follows strict regulations that prioritize infection prevention and control. Establishing a safe and effective quarantine facility, according to the World Health Organization, includes factoring in the site layout. This layout should establish distinct triage areas at the entrance, isolation rooms for confirmed cases and suspected cases. The bedding spacing should also be at least 2 meters apart and traffic flows within the facility regulated. WHO also suggests that the rooms must be well ventilated. The centers should also have non-touch hand-washing stations with soap and running water. There should be routine disinfection and proper waste disposal and strict limitations when it comes to patient visitations, among other measures.
We are also putting up holding and areas within the border in the event that we get a case. So the country is fully prepared for this Ebola. As the Ebola wave continues to sweep through the Democratic Republic of Congo, with infections spilling over to neighbouring countries like Uganda, WHO says the outbreak has outpaced response efforts. And now, these efforts are threatened by catastrophic collision of disease and conflict in Ituri province. Gloria Milimu, KTN.
Now, reports that the United States